Hello, everyone. Today we will learn about the regional structures of the lower limb. Superior piriformis foramen and inferior piriformis foramen. The superior piriformis foramen is located deep to the gluteus maximus muscle, between the superior and inferior margins of the piriformis muscle and the greater sciatic foramen. The superior gluteal vessels and superior gluteal nerve exit the pelvic cavity through the superior piriformis foramen. The sciatic nerve, inferior gluteal vessels, inferior gluteal nerve, pudendal vessels, and pudendal nerve enter and exit the pelvic girdle through the inferior piriformis foramen. 2. Vascular compartment and muscular compartment. The vascular compartment and muscular compartment are located between the inguinal ligament and the hip bone, separated by the iliopectineal arch, a bundle of fibers connecting the inguinal ligament to the iliopectineal eminence. The medial side of the iliopectineal arch is the vascular compartment, through which the femoral vessels pass. The lateral side is the muscular compartment, through which the iliopsoas muscle and femoral nerve pass. 3. Femoral canal. The femoral canal is the most medial part of the vascular compartment, a small space approximately 1.2 centimeters long, and a funnel-shaped blind sac protruding downward from the transverse abdominal fascia. Its superior opening is called the femoral ring, with the anterior boundary being the inguinal ligament, the posterior boundary, the pectineal ligament, the medial boundary, the lacunar ligament, also called the faux-folar ligament. On the lateral boundary, the vascular sheath of the femoral vein, if abdominal or pelvic contents protrude through this ring into the femoral canal, it is called a femoral hernia, which is more common in women. 4. Femoral triangle. The femoral triangle is located in the upper part of the anterior thigh, with the upper boundary being the inguinal ligament, the medial boundary, the medial margin of the adductor longus muscle. On the lateral boundary, the medial margin of the sartorius muscle, the anterior wall of the femoral triangle is the fascia lata, and the floor consists of the iliopsoas muscle, sphacteinias muscle, and adductor longus muscle within the femoral triangle. There are the femoral nerve, femoral vessels, and lymph nodes. Efib adductor canal. The adductor canal is located in the middle of the thigh, deep to the sartorius muscle. Its anterior wall is the adductor magnus tendon plate, posterior wall, the adductor magnus muscle, and lateral wall, the vastus medialis muscle. Its superior opening is the apex of the femoral triangle, and its inferior opening is the adductor hiatus, which leads to the popliteal fossa. The femoral vessels and saphenous nerve pass through the canal. 6. Popliteal fossa. The popliteal fossa is rhomboid-shaped posterior to the knee joint. Its superolateral boundary is the biceps femoris muscle, and its superomedial boundary is the semitendinosus muscle and semimembranosus muscle. The infralateral and infromedial boundaries are the lateral and medial heads of the gastrocnemius muscle, respectively, and the floor is the knee joint capsule. Within the fossa, there are the popliteal vessels, tibial nerve, common peroneal nerve, fat, and fascia. Next, let's look at the fascia of the lower limb. The fascia of the lower limb is relatively well developed, especially the deep fascia. The deep fascia of the thigh is the thickest fascia in the body, called the fascia lata. It attaches superiorly to the inguinal ligament and iliac crest, extends to the gluteal fascia, and continues inferiorly with the deep fascia of the lower leg. Approximately 3 centimeters infralateral to the pubic tubercle, the fascia lata forms an oval-shaped weak area called the saphenous vein hiatus, also called the oval fossa. The fascia covering the surface of the fossa is sieve-like, called the cribriform fascia, through which the great saphenous vein, lymphatic vessels, and nerves pass. The fascia lata sheaths the muscles of the thigh, penetrates between the muscle groups, forms 3 intermuscular septa, medial, lateral, and posterior, and attaches to the femur. The lateral part of the fascia lata is the thickest, forming a flat band called the iliotibial band. The deep fascia of the lower leg wraps around the calf muscles and attaches to the medial surface of the tibia. On the lateral side of the lower leg, the deep fascia gives rise to anterior and posterior intermuscular septa that attach to the fibula. Near the ankle joint, the fascia thickens to form several retinacula. There is a superior extensor retinaculum on the anterior lower leg, an inferior extensor retinaculum anterior to the ankle joint, a flexor retinaculum postero-inferior to the medial malleolus, and a superior peroneal retinaculum and inferior peroneal retinaculum postero-inferior to the lateral malleolus. These retinacula restrict the tendons passing anterior and posterior to the ankle joint. The blood vessels and nerves leading to the foot are all deep to these retinacula. The tendons of the calf muscles are all surrounded by synovial sheaths of tendons as they pass around the ankle joint. The deep fascia of the plantar region thickens in the middle of the sole to form the plantar aponeurosis, which acts as the string of the longitudinal arch of the foot and strengthens the longitudinal arch.